Welcome, everybody. Thank you so much for taking the time to be here with us today. As you know, this is our second session of Inside the Operating Room, and tonight we're very honored to have Dr. Carmen Solorzano join us all the way from Nashville, Tennessee. I'm going to take the time right now to give you a little bit of background and a little bit of information about the Latino Surgical Society before we go ahead and commence with the formal program for tonight. So as you know, the Latino Surgical Society is a relatively new organization. We founded this approximately 4 years ago now. The Latino Surgical Society was established to cultivate, nurture, and support the advancement of Latino surgeons. How this started is that 4 of us who were friends and in training at the time actually crossed paths at different points. I was a surgical resident at Sinai Hospital in Baltimore. Drs. Gesser Ortega and Dr. Joseph Lopez, who are also good friends, happened to also be working there during that time. And there was one night when all the stars aligned and the 3 of us happened to be on call. It was a relatively rare occasion where the entire surgical team consisted of Latino surgical residents. During that night, there was a conversation that we had about just how few of us existed and how few of us we knew across the country, that we could literally count on our own hands how many of our peers were Latino. And having come from organizations that really supported our development in medical school, like the Latino Medical Student Association, we thought it'd be a great opportunity to do something to help build a similar support network. Dr. Joseph Fernandez More and I actually crossed paths as well during surgical training when we were both moonlighting in Houston, where he completed his surgical residency. And he also had a similar notion of wanting to give back to the medical students and really try to help develop the pipeline of Latino medical students who wanted to pursue careers in medicine and specifically surgery. And so the 4 of us got together, and long story short, we put a lot of work into making the LSS a reality. We are now a nonprofit organization. We have incorporated as a formal organization. And as we're here tonight, I'd like to say that we've been successful at establishing that network that we really dreamed of several years ago. So we'd like to take the time right now to thank several institutions and departments of surgery across the country who have demonstrated a commitment to supporting the Latino Surgical Society. We'd like to start off by thanking Massachusetts General Hospital Department of Surgery. Thank you to Drs. Keith Lulamo and Fernandez del Castillo for your support. The University of California, San Francisco Department of Surgery, who have enlisted as well as an institutional member. Thank you to Drs. Julianne Sosa, Drs. Adnan Al-Saidi and Andre Campbell for your support. And last but not least, we'd like to thank the University of Washington Department of Surgery, who have also enlisted their support. We'd like to extend thanks to Dr. Wood, Dr. Reyes, and Dr. Pellegrini for your support. We'd encourage all of you to join us as formal members of the Latino Surgical Society. You can connect with us using our website, our social media channels, and within the next week, we'll also be uploading this session of our Inside the Operating Room webinar so that you can view it on our YouTube channel. So I'd like to take the time to introduce our panelists and discuss with you a little bit about the format that we'll be following for tonight's session. I'm Dr. Minerva Romero Arenas. I'm an assistant professor of surgery at Weill Cornell Medicine and an endocrine and general surgeon at Brooklyn Methodist Hospital. I'm a founding member of the Latino Surgical Society, and I'm honored to have you all with us today. In addition to this, I'd like to introduce Drs. Gesser Ortega and Dr. Joseph Fernandez More, who are also founding members of the Latino Surgical Society. Dr. Gesser Ortega is an instructor at the Center for Surgery and Public Health at Brigham Women's Hospital and Harvard Medical School. Dr. Joseph Fernandez More is an assistant professor of surgery, trauma, acute and critical care at Duke University in Raleigh, North Carolina. And our other founding member is unable to be here with us today because he's in the OR, Dr. Joseph Lopez, who's a craniofacial surgery fellow at the Yale Craniofacial Oral and Dental Center in New Haven. So he cannot be here with us today. And our third panelist is going to be Dr. Chantal Reyna, who's a breast surgical oncologist. She's an associate professor of surgery at the University of Cincinnati, and she has recently taken the role of LSS liaison to the Association of Women Surgeons. Dr. Reyna, I'm going to turn it over to you.
Thank you so much for all that introduction and letting us all know about the group that'll be with us tonight. I have the pleasure of introducing our distinguished guest of honor, Dr. Carmen C. Solorzano. She's a professor of surgery and chair of the Department of Surgery and director of endocrine surgery at Vanderbilt University Medical Center in Nashville, Tennessee. She holds the John L. Sawyers Endowed Chair in Surgical Sciences. She is a graduate of the University of Florida General Surgery Program and completed a surgical oncology fellowship at the University of Texas MD Anderson Cancer Center. She is actively involved in teaching endocrine and surgical oncology. Her clinical research interests include minimally invasive techniques for parathyroid and adrenal tumors, the use of near-infrared light to detect parathyroid endocrine tumors, the use of surgeon-performed ultrasound for thyroid and parathyroid disease, and the treatment of neuroendocrine tumors and MEN syndromes. Not only has she published more than 160 articles and book chapters, she serves on editorial boards of the Annals of Surgical Oncology, the Journal of Surgical Oncologies, JACS, and the World Journal of Surgery. She's also an associate editor of the American Journal of Surgery, the HPV section. She served as past vice president of the American Association of Endocrine Surgeons and serves as governor of the American College of Surgeons, representing the AAES, the ACS Board of Governors liaison to the COC, vice chair of the Society of Surgical Oncology, Endocrine, and Head and Neck Site Disease Working Group, the American Thyroid Association Thyroid Nodules Guidelines Task Force, and the American Board of Surgery CE Endocrine Question Consultants. So that is very, very impressive list of accomplishments. And so I'm just very honored to have her being a part of this panel today. So Dr. Solorzano, thank you for being with us in our second Inside the Operating Room. Before we get started, just to give you an idea about the format for not just this portion, but to our participants as well. We are modeling this after the Inside Operating Room series, after the James Lipton Inside the Actor Studios, during which he interviews actors that have profound impact on industry. These interviews were multidimensional and delved deeply and professionally and personally. And I want to do justice to the late Jane Lipton's unique technique and interviewing style. I will end with some of the standard questions that Jane Lipton asked to all of the interviews to all the actors he interviewed. We'll also give our participants the opportunity to ask questions using the Q&A function, and we'll be reviewing those questions and asking them. So let us begin. So once again, we are honored to have you with us, and we are especially honored because you play a huge role model in the American academic surgery world. Many of us know that you are originally from Honduras. Can you tell us about your experience, where you were born, how you were raised?
Yes, thank you so very much for that excellent introduction, Dr. Rain. And I'm exceedingly proud of what you have accomplished. And to see highly accomplished Latinos in the United States in medicine and in surgery, it's really a wonderful sight, because when I arrived here in late 1985, and that might tell you a little bit about my age, perhaps we didn't see that as much. So going back to your question, it's kind of where where I'm coming from. So I was actually born in Managua, Nicaragua. I'm Nicaraguan, not Honduran, but my childhood was really a great childhood. My parents both were born in Nicaragua and have lived there most of their lives. My father, unfortunately, just passed of COVID this past May, but he was 84. He lived a fantastic life and was a great role model for me. My mother's still alive and about to move to Nashville, Tennessee from Managua, Nicaragua. But so I lived through a revolution when I was 11 years old in 1979. And then I moved to the United States to go to school, to go to college. And this is kind of what folks could do at that time. If you could afford it, you could come to the United States and then go back to Nicaragua to practice there. But the political times in Nicaragua were unstable. So I decided ultimately to stay in the United States, became interested in medicine, and started in a small community college in Miami because the savings for my dad and my mom had sort of decimated due to the revolution in Nicaragua. And so I started there. I did summer jobs and then ultimately transferred to the University of Florida, which was a fantastic place for me to start my undergraduate or part of my undergraduate career, as well as medicine and ultimately residency, which I did there. And so that's how it all started for me, and slowly got much better. But we could get into more details if you wanted to, as to how the career continued.
Dr. Solorzano, thank you for that story, and that's extremely motivating. And I mean, so many people share that this kind of just moving from one country to the next, and just, I mean, learning the language, learning the culture. Mm-hmm. I mean, how did you? I'm fascinated and interested by it, but how did you kind of navigate that? You know, as a young student going through these different academic institutions early on in your career, and then and what made you choose surgery? Like, as you know, what was the motivation, the inspiration for that?
Yeah, so I was quite fortunate that I didn't have to deal with visa issues, which I know a lot of folks have to deal with, an entry into the United States. My mother had lived in the United States as a young woman. My grandparents lived in New Orleans and LA. And so she became a naturalized citizen. And I benefited from that because when it came time to the revolution, my mother allowed us to be to get a green card. So I had a green card. And that allowed me to come to the United States without the visa issues, which, you know, I know a lot of folks have to deal with. And I see that and respect that, and I have a lot of insight into what it takes to arrive into the United States. So how did I negotiate that? Well, we learned English in Nicaragua the best we could. I actually was exchange student when I was 11. I came to the United States to Dayton, Ohio, and I learned English there. Ultimately, that helped, and I arrived in Miami. I could read and write English pretty well, good comprehension, etc. But it was kind of a shock. But I did have a lot of support, a lot of community there. A lot of Nicaraguans had arrived there. Ultimately, there were friends of mine in Gainesville, Florida, Nicaraguans, and I could move there ultimately to go to college there. And they had, I could pay $100 rent and live with them in their place. So that was very good. Ultimately, I became interested I was interested in science all along. Although, you know, my parents discouraged that somewhat. You know, you're a woman, why are you doing medicine? You can't have a family, you can't have children. What about your husband? But this was my passion. I like science. I ultimately became interested in medicine, and that's what I was going to pursue. And surgery, I don't know. I became interested in surgery pretty much immediately when I did my rotations in surgery, which allowed me to see the art of surgery, which I absolutely love. The immediacy of helping somebody in need, and also the fact that we understand the physiology of these folks. So I think in part I became interested in medicine because my grandma had developed breast cancer, and I saw her pass away from that. But my ultimate interest in surgery was during my medical school years. So negotiating that, it was a slow process. And I can go into more details.
Thank you for that awesome answer, Dr. Solorzano. It's an amazing, amazing story to hear, to come from Central America and come into the United States and flourish so brightly. Funny, we actually may have crossed paths briefly while I grew up in Miami. I was born there and lived there till 1987. So I am intimately, from my family sort of came in a similar way. And, mentorship becomes such an important function within all of our professional and personal lives. Sponsorship as well has really become an evolving theme in residency and academic progression. And so who were some mentors, sponsors of yours that ushered you through the gates of surgery and medicine to get to where you are, either family, friends, peers, those surgical heroes that we sort of all, carry with us throughout our career. So who are some of those folks for you?
Yeah, so I entered medical school. There was no one in my family in medicine. We had engineers, lots of engineers. Perhaps I guess my grandfather on the side of my mom was a dentist. That's as close as we came to medicine. Mm-hmm. So I entered medical school and had watched those surgeons that were they were kind. They were nice to me. They took care of patients. They had great outcomes. And ultimately I said to myself, well, I'm going to be like them. And did I have somebody that was a sponsor then? I'm not sure. I'm sure I did. Perhaps I could think of a transplant surgeon that I much appreciated him. And he said to me, you do a great job and you should go into surgery. And so I did. I applied and I got in. I stayed at University of Florida where I did my medical school. And there were no women faculty at the University of Florida then. There were 2 women residents in our program. Ultimately, after that, it got that there were more women residents coming through. But those mentors of mine, mentorship is a connection that you make with someone, and it comes in many, many different ways. I identified with some of my attending surgeons. They were all men at the time because there were no women attendings then. And so I modeled behavior. I really appreciated some of the surgeons that were great physicians, great surgeons, and great people. And they were very nice to me. And I believe that, they were my mentors to a certain extent. I didn't really have, I don't know, when you think of mentorship, you want, sit down with them and chat all the time. I didn't have that. And I know that's so important today. So I make a point to, at least in my department right now, we're trying to put structure to mentorship so that faculty, so that residents can have that connection. We were assigned mentors as residents, and that didn't always work. So you pick your mentors, and you pick and you find what you're interested in, and then ask them questions, and they give you advice. And so that's what I did. And I had a couple of folks that I relied on significantly that ultimately helped me out shape my decision making. And then I also had sponsors, which I didn't, we didn't have a name for this then. Sponsors. I mean, today it's popular to talk about sponsors, but we didn't have a name for that. It's that person that picks up the phone for you and calls for that fellowship, for that connection, for that position in, that society that you're interested in. So I believe that I had a lot of great people in my residency, and a lot of great faculty that were kind and were great surgeons, and helped me navigate the different decisions I made. But you have to seek those folks and go reach out to them too. They're not always going to come to you. So.
Thank you for that. That's amazing. I know that I've held people, and we were speaking earlier about Dr. Bass and how she was such an influential mentor and sponsor for me, and helping me negotiate residency in surgery and science. And you started to allude to it with your previous answer, and the negotiation of a path in academic surgery, and getting through just the world of surgery. And so I wanted to follow up with that and hear a little bit more about the details of that for you, and maybe how mentorship and sponsorship really facilitated that and shaped it for you to become so involved in academic surgery, and then want to shape it for those that are coming up that you have a significant influence in.
Yeah, so I my mentors in residency, I would quote, would be Kirby Bland, Ted Copeland, Dick Howard, just to put names, surgical oncologists and transplant surgeons. And so these folks, I watched, I loved what they did. I loved how they behaved. So I modeled and I looked at what I thought was something I wanted to be. And they helped me as mentors, because I met with them. I asked them, these are my interests. What should I do? Should I go into research? And why is that something that I need to do? Sometimes you just don't exactly know. I wasn't as organized as some of the residents today. They're very organized. They know their path. They're going to be a chair. They're going to do health services research. They're going to go global surgery. And that's really great. But I wasn't as organized in that way. I knew I wanted to ultimately be like these folks. I love the fact that they were the professors, that they taught, that they led by example. And so I said, okay, I'm going to go and be a surgical oncologist, because that's what I decided to do. So how do I navigate this? Well, I'm going to ask. So I asked, you got to join this society. You've got to do some research. So I went into the lab and I happened to do inflammation research because that was the lab that was there. But I learned a lot. I learned a tremendous amount about how to think science, how to think about how to ask a question. And so for those who are thinking about, whether they should do research, whether they should do basic or health services or administration, do what your passion takes you. Do what makes you happy. So then my path took me to surgical oncology. So guess what? I wanted to go to the best surgical oncology program I could go to, if I could. So, I'm I'm gonna try. And I did very well in residency. I did very good research. I published, and ultimately I matched at the MD Anderson. And okay, so I didn't necessarily go to Harvard. I went to the University of Florida, right? It's a state school. Guess what? You can get places. You don't have to go to Harvard. You just have to do the work, be passionate, love what you do, and hopefully have sponsors, because you do need sponsors, very important. And so I went to MD Anderson. Actually, MD Anderson opened a lot of doors for me. Yes, you perhaps you go to a state school, then you get to the next echelon in fellowship, and that opened a lot of doors. I did, again, I worked really hard. I did research there, and I made connections, and you know, and I loved it, and I've loved every bit of it, and I continue to love what I do. So that's how it went down, and I continue to have mentors, sponsors. Again, you know, sometimes it's nebulous. Sometimes it's not. It's one mentor for one thing and another one for another. And in retrospect, you can then pinpoint who those people were. Perhaps not at the time, but I hope that answered your question.
No, that was fantastic. Thank you for elaborating on that. There are two things that you mentioned. Number one is that mentors can be multiple people for different things. And I think that's something that we always, at least when we were younger, I always said, oh, I need this person to mentor me or this person to mentor me, not realizing that it's going to be a little bit of a here and if so, a research mentor here. So I think really mentioning that is very powerful, especially for our audience. The second thing you said, and you probably couldn't see us, but Minerva and I are over here clapping, that you can go to a state school and still go places. I went to the University of Nevada, state school, you know, did my training, ended up, you know, going to a fellowship and then working at large centers. So I think that is just a really important point, that you can get there, but you're right, you do need some mentors, you do need some sponsors.
Yeah.
Someone kind of was wondering, you know, did you wish that you had stronger or more personal mentors? Do you really think it would have made a difference if it was as pertinent or as present as it is now?
I think, I mean, I don't know. I consider myself my path has been very successful. I'm very happy with it. You know, you wonder, you know, what if? But to me, I'm somebody who, if it appeared that something didn't work out in this direction, well, guess what? The other direction also took you somewhere that you may have never seen if you went the other one. So yeah, I guess it would have been nice if I had a specific person that I would sit down with on a regular basis, to have my mentorship committee of 5 people that I went with. I think it would have been nice. It would have been perhaps better. I may have gotten places a little faster than I did. So I think it's good to have that. Did it affect my career? I have no idea. I can't go back and redo it. But I tell you, persistence and having a goal. I think. What's your goal? What's your passion? Pursue that, and pursue it in an organized way. Don't let it just come. Right? You've got to do it. You've got to plan it. Okay, this is my next goal. I'm going to get to it. So how do I get to it? Find out how you get to it. Find out what the steps are. It's not going to be handed to you. At least it wasn't handed to me. You got to work all the way. And I'm a big believer that if you work hard and let people see your work, that you'll get there. Again, you need some people to appreciate that work and put you up. So again, we're going back to the sponsors. And part of the position I'm in now is, why am I doing this? Because I want to be a sponsor. If I can make a difference in somebody's career, that's what I'm going to try to do. So yeah, I think that it would have been great to have a more structured way, but it happened. I consider myself a very lucky person, and I love what I do, and continue to. So I want more people to do it.
Well, you've definitely accomplished a lot, as you know, reading through that very long list of accomplishments that I, mainly stumbled through. But one of the things is you have done so much, you've kept yourself grounded. What has kept you so grounded as you've continued through your career?
That's a great question. I think you have to have balance with your family or your friends, your loved ones. Actually, I think that I could be a workaholic. I'm still a workaholic. I'm gonna admit it right here. And so what kept me grounded? I actually think my wife kept me grounded. She's somebody that sort of I spend a lot of time, and she tells me, you're doing too much. Go do something else. So we take hobbies, we do different things, and she tells me when I'm going crazy doing only surgery stuff. So I that's kind of a simple answer, but your loved ones keep you grounded. For me, that's who it has. I've seen many of my friends who have been, well, I would say more successful than me, and perhaps sometimes they lost sight of balance there, because you have to be happy, you have to keep a home. After all, this all goes away. It's your family that stays there. So
that's a great answer, Dr. Solorzano. I wanted to follow up on that. And in my own residency and professional career, I've lost attendings and mentors to the loss of that groundedness and the absence of the work-life balance. And now in a position of such responsibility, how do you do it for yourself, and how do you advocate for it in your faculty and in your residents, the maintenance of that work life and the respect of that balance in our professional lives?
I mean, for myself, I think, how do I do it? So I love what I do. I've said it several times. So I actually love going to work. I love to operate. I'm even as a chair, I still keep a busy practice because I love it. So when you go home, you have to set time for yourself and for whatever you're going to do with your family. And it has to be planned out, because if you don't plan it out, it's not going to work out. The work takes over, or something else takes over. So in a way, you can't procrastinate with the work that you have at work, because if you procrastinate with it, it'll spill into your family time or your time at home. For the residents, it should be kind of a similar recipe, I hope, where you plan out your time, and the faculty the same. So if you have, put it on an Excel sheet. I don't know. I mean, organize it so that you can have that balance. Now, I don't have children, and I appreciate that takes, it adds another dimension to work-life balance. But I see many of my faculty who are extremely accomplished, who have been able to achieve that balance. And they do it by having discipline, I think. in the end is having discipline to organize and to respect each of those buckets of time without procrastinating in each one of them.
So I'm going to switch gears a little bit here. We're going to get ready to take some questions from the audience. And so while Joe, Chantal, and Gester are doing that, I wanted to ask, as a fellow endocrine surgeon myself, I want to know if you can talk a little bit first about how did you decide to pursue training in surgical oncology, and to follow up, then how did you decide to specifically focus in endocrine surgery?
Thank you for asking that. Well, surgical oncology, you know, I think we all end up doing, going into a field in surgery, perhaps because the people we watched, the people in the patients that we saw. And so that's kind of how it started for me. Those surgeons that I told you at the beginning that I respected were surgical oncologists. And I loved their practice and how the patients were, et cetera. So that's in part how I decided to do surgical oncology. The diseases were very interesting, and what you could do for patients in the surgeries, et cetera. Once I got to do surgical oncology, I had certain interests, and one of them was endocrine neoplasms. But I have to admit that, you know, things don't always exactly work the way you see them working. And you have to be flexible, and you have to accept that. And sometimes it actually leads you to a path that maybe it was better. So I wanted my practice to incorporate a lot of pancreas. I don't know what I was thinking, but so I went to MD Anderson, and I nearly stayed there to do pancreas, and that didn't work out. But anyway, but I also, again, Minerva, to answer the question about endocrine, also, I saw a lot of endocrine neoplasms, and again, the people that I watched that were fantastic surgeons, great clinicians, kind folks, were the endocrine pancreatic surgeons at the MD Anderson. Folks like Doug Evans and Jeff Lee, et cetera. So I became interested in that. And the first job I took, I thought, well, I want to do pancreas, and I want to do some endocrine neoplasms. But I never really got to do all the pancreas that I wanted to do. And I think it's a blessing in disguise, whatever. My practice got very busy, and I happened to take a job where the retiring surgeon was George L. Irvin. For those who don't know who that is, this is the guy that practicalized the PTH, parathyroid hormone. So it was like the perfect scenario for me to utilize what was at the time something I could build my career on. I mean, I didn't think I was going to go from being a surgical oncologist to focusing a lot of the writing. My initial writing was on intraoperative PTH. And so, the path it's not always straight. You go in little branches and take advantage of what's there. Don't go, I'm not gonna be that pancreatic surgeon, or I'm not gonna do this because, it's not here. Rather take the opportunities that are there and go with them. So I took the opportunity I built an endocrine practice. I did also do general surgical oncology at a county hospital at the University of Miami, which was a great experience. But my focus became endocrine tumors. And I took my advantage was that George Irvin was there. and he introduced me. He was my sponsor in a lot of ways in my junior years. And so I took that. In addition, they also were doing they were doing ultrasound in the clinic. I didn't know how to do an ultrasound. MD Anderson, they give you everything. They give you all the ultrasounds. They do the biopsies for you. At University of Miami, you couldn't even get an ultrasound. So we started doing it in the clinic, and I wrote a bunch about that and became an expert in ultrasound in the clinic, became an expert in intraoperative PTH, et cetera. So I don't know. The lesson is I became interested in endocrine tumors, and I've made my career based on that. I've written about it. I ask questions related to what I see in the clinic, and that's been exceedingly fulfilling and has helped me advance my career, if you will.
Thank you so much for sharing that. And as you were sharing that, I actually thought about what interested me in endocrine surgery. And if I can trace it all the way back, I actually thought the coolest thing that I saw, one of the coolest things I saw in the OR was the intraoperative PTH when I was a student. So it's funny how tremendous of an impact Dr. Irvin's work has had. I'm gonna go ahead and turn it over back to the group because they're getting ready to ask some questions from the audience.
Dr. Solorzano, amazing answers, amazing talk so far. One of the things that I really enjoy, and I'm so fascinated just from hearing your story from like the very beginning all the way up to this point so far, you've never shied away from anything hard. Even the fact that you said, I want to study the pancreas. I mean, in surgery, we're like, whoa, okay. So I think that's so, and you alluded to a little bit just in your earlier talking about challenges, but one of the questions that came up among our attendees was, how do you handle challenges? How have you dealt with roadblocks and any failures that have come up in your career so far?
I guess what? You take the failure and you learn from it. The people that don't fail, they do not learn. So you have to be resilient, and you have to bounce back, and you pick up and you go, well, this didn't work, so I'm gonna try it this way. So I think that you can't let failure take you down. That would be my advice. Let me just tell you, when I was, not a lot of people know this, but I'm going to share it with 47 people and you all, whoever. When I was applying to fellowship, I had my chair, my chair thought, you have a fantastic CV. You've done everything. I won my best teaching resident. So your CV can speak for itself. So I applied to 2 programs, the 2 top programs in surgical oncology. And guess what? I didn't match. Long story, I did end up there. But that was a very disappointing moment in my life. I felt, well, I'm not good enough. Nobody picked up the phone for me, etc. But after a little bit of disappointment, I just went back and I said, okay, make the phone call. How do I get to this place? I'm not going to go to Buffalo because that was the other option. I'm going to go to Buffalo and I'm going to freeze to death there. No, I'm not. I'm a Latina. I can't go to Buffalo. So somehow I ended up in, phone call was made. I went to MD Anderson. I did research, and then I matched. It's one example. There's been other things. And so you just have to pick up and fight for yourself, and hopefully you'll have people that support you in that fight, and just get up and go.
That's amazing. Thank you, Dr. Solorzano. Another question from the audience. What advice do you have for medical students? And, you know, maybe with some special attention to the increasing diversification of our medical student population, and particularly Latinos that are going into medicine, but for medical students that are currently applying to general surgery, and what do you wish you would have thought about while deciding that, and what best suited you in a future in academia?
So I would advise to apply, to don't say, oh, I can't, they won't take me there. Apply to your pie in the sky, if you will. And you may not get it. My top choice wasn't the University of Florida, but I went to the University of Florida, and here I am talking to you all. So apply and go for it, would be my advice to the medical students. Now, and also take into account your family, take into account the things that fit with your overall happiness too. I just think that's also very important. Where you fit in, or you believe that you fit in best in an environment that will be supportive for you. So residency is a tough time. We all know that. We all did it. So there's just, you just have to be in the right place. So try to go to a place that feels right to you, even if it's not the top place.
I guess also as a follow-up to that, what advice would you have given to your younger self in this career path? Things that you may have done differently? Sounds like you made all of the right decisions. At least to get to where you got.
I don't think so. I made decisions. They always lead to something, right? So, I think in retrospect, perhaps, I don't know. I think that I ended up in a pretty decent place. I applied to different places. I don't know. I was low maintenance, I would say. I wanted to go to medical school. And from there, I wanted to go to a residency program that gave me good training. I don't know how you find out anymore what gives you good training, other than by asking people and making sure that that what they're telling you is true. So I asked all those folks, all those mentors that I had found in medical school. I asked as many people as I could, where should I go and where should I not go? And I don't have any. I think if anything, ignorance was a bliss in a lot of ways. I don't know. I don't know if I did the right thing or not. In the end, it worked out for me. Perhaps planning too much is too much on you. It weighs on you. I didn't. I was recommended to go different places and that would give me excellent training in surgery, because that was my passion at the time. And that's where I went.
Thank you so much, Dr. Solorzano. We're gonna do one more question. And the question is, in watching trainees or younger faculty over the years, are there any common mistakes or common things that you think people have done in terms of doing things right, even trying to achieve balance in academic surgery?
So I tell faculty that want to advance in academic surgery to pursue their passion, to stay engaged, to come up with the goal and figure out what the steps are to get there. I often see faculty that just sort of struggle getting to that goal, but they appear to not have made the full effort to get there, and then begin to complain, well, I didn't get there. So be proactive and stay engaged and communicate, and set goals. If you want to be an academician and be, in a, move up in the ranks, you have to play the game. I don't like the game. I don't really like the academic game. So you have to stay engaged and play the game as long as it stays with your moral compass. And that's what I have done. I don't like to play this game of sometimes, I don't know what the word is, greasing or brown nosing, or it doesn't work for me. I never did it, and perhaps maybe that didn't get me in certain places. But so I enjoy going to meetings. I enjoyed meeting folks, and that was part of my goal to the extent that I enjoyed it. So you asked about what pitfalls or that I see at times is people get too wrapped up in this whole thing. Enjoy what you're doing. Enjoy your research. What are you doing research for? You're doing research for improving patient care. That's the only reason you're doing it, I hope. Why did you go into surgery? Because you love it, I hope. And the reason is because you love taking care of patients. That's why I went into surgery, and not because I want to be the president of the American Surgical Association. That was not my passion. Oh, maybe I'll get to be the president of the American Surgical Association. I haven't ruled it out, but I don't know. But don't get all wrapped up in this stuff. It'll take you places that you don't want to go. So enjoy your path.
Okay, thank you for that great advice. And we may have just started your campaign for president of the So I'm going to transition, and what we'll do now is actually a series of rapid fire questions. Again, you're supposed to really sort of just say the first thing that comes to mind.
Okay.
So we purposefully did not give you these in advance. What's your favorite word?
My favorite word? No. That's what the residents tell me.
Fair. What's your, what sound or noise do you love?
Oh, the ocean. The waves of the ocean.
It's very soothing. I'm told that it's a very rhythmic noise that's supposed to remind us of intrauterine heartbeat.
Is that right? I don't know. I liked it when I used to go to the beach and stay nights at the beach. I love it. I love at night to hear the ocean.
What do you like the most about the operating room?
The method, the intricacy of what we do, the details of surgery, and removing, reconstructing, my hands working to improve the patient.
What do you like the least?
When it doesn't run efficiently, when it falls apart, when people are not engaged in the patient care, because that's why we're there.
Yes. If you were not a surgeon, what other profession would you like to attempt?
Maybe somebody that works for REI or Backroads, or do these hiking, biking expeditions and things like that.
Okay,
So like
outdoors,
outdoorsy.
fair. Last question, thyroid, parathyroid, or adrenals?
I love them all.
Secret answer could be pancreas.
I still do some pancreas. I mean, I did, I still do neuroendocrine.
Wonderful. Well, I'd like to thank you for joining us tonight. And on behalf of all of the founders and all of our audience who joined us tonight, we really thank you for taking the time to be with us and to share your story with us. We do express our condolences. I know you shared the loss of a family member earlier, so we do want to take the time to acknowledge that. And thank you for taking time out of your busy schedule for this event. Everyone in the audience, we'd like to thank you for joining us and hope that you tune in for our next episode. We will do our best to get this up within the week on our YouTube channel. Thank you and good night.
Thank you so much.